Ozempic has been making headlines as a so-called miracle drug to treat type 2 diabetes. Now a new study shows that injections of the drug, known generically as semaglutide, can significantly reduce the risk of kidney and heart complications in diabetic patients. And the research was funded by Novo Nordisk, the maker of brand Ozempic. And for more on this study, we're joined by Dr. Christopher Labos. He's an epidemiologist and cardiologist and the author of Does Coffee Cause Cancer? Always great to have you on the program, Dr. Labos.
Oh, always a pleasure to be here.
So, there's been so much interest for various reasons in what we know as Ozempic. Lots of studies have been done. Why is this one different?
This one is different because it was the first large trial that specifically looked at kidney outcomes. So I think we've fairly well established that this medication is a very good diabetes treatment. We've established that it can lead to weight loss. We've established that there are cardiovascular benefits. And now we have a trial establishing that there are kidney benefits as well. And this is important because the goal of giving this medication to people is not for aesthetics, it's not for cosmetics, it's not just to pretty up the numbers on your blood tests, it's to prevent disease. And so if we can prevent cardiovascular events, if we can slow the decline in kidney function that happens in diabetics, you go a long way to preventing very, very serious morbidity, like people developing heart failure after a heart attack or people needing dialysis because of kidney failure. So there are very real practical benefits to this, and that's why we're talking about these medications as often as we do.
As we know, many people have been using Ozempic off-label for things like weight loss, but this wasn't a study that looked at weight loss.
No, it wasn't. This was again, a medical, these are all medical studies, but this was a study specifically looking at medical outcomes about the health benefits that go with it. And, this is a very real problem. I'm a cardiologist by training, so obviously we talk about the cardiovascular outcomes, but the renal outcomes are important too. And especially with diabetics, one of the most common causes of kidney failure is because of diabetes. So if you have a new medication that can help prevent that and prevent people from developing worsening renal function or needing dialysis or something like that, that's going to have a profound impact and frankly a profound cost savings on our healthcare system as well. So there are important implications to this study above and beyond this medication's use as a weight loss drug.
Ozempic, as we know, is often not covered by government insurance. Would this study change that, do you think?
Hard to say. A lot of that is going to depend on how Medicare in the U.S. acts, because as Medicare in the U.S. acts, that influences how U.S. insurance companies act. And then once things start in the U.S., Canada usually tends to follow suit. I don't know that this is going to push regulators to end up covering Ozempic as a weight loss medication or semaglutide as a weight loss medication, to be perfectly accurate. But I think it will sort of give increasing argumentation to the point that we should be using it more broadly in diabetic patients, especially diabetic patients that have underlying cardiovascular and renal problems, because it really is preventing these secondary consequences of that disease.
It is expensive, as we say. Is this a long-term viable solution for patients with kidney disease with the price tag that it comes with?
I think it is. Now, we can do some quick, back-of-the-envelope mathematics here. These are expensive medications. Each dose is going to run several $100s. There are ways to bring that down when you buy in bulk. But if you consider sort of the end-term complications of renal failure, which is dialysis, that's going to cost hundreds of thousands of dollars per year to keep a patient on dialysis. So there's obviously an economic argument to be made for using these medications to prevent disease. And of course, you add on the, fewer number of heart attacks, less heart failure, all those types of things. This all makes a difference. Now, there's a whole science to doing cost effectiveness analysis, and a lot's going to depend on what the ultimate price tag of this medication is if it were being bought in bulk by OHIP or RAMQ or whatever the provincial funding source is in your province. So there's an argument to be made here, but that's why we are talking about it, it's because it is going to prevent these long-term complications that can be very, very expensive for the healthcare system when you have patients who are chronic heart failure patients or chronic dialysis patients.
We've seen people flocking towards Ozempic, semaglutides, but there have been warnings from medical experts that, it sounds great, but it's not a fix-all.
No.
Certainly sounds like, when we hear about all these benefits, that it might be fix-all. You can kind of understand why maybe people might feel that way. Do the benefits outweigh the side effects here?
Yes, absolutely, if you use it in the right patient population. I mean, we had a very similar conversation around aspirin in the late 1980s when we really started first using aspirin for cardiovascular disease. It makes a big difference if you're having a heart attack. And yet, not everybody needs to be on aspirin. And that was the big sort of debate that was going on in the 1990s. Not everybody over 50 needs to be on an aspirin. That is not true. And so, we have to use this medication in the right way. Do the benefits outweigh the risk? Absolutely. If you're a diabetic, if you have the metabolic complications of obesity, if you have high blood pressure, if you're at higher risk for heart disease, if you're suffering from kidney disease now, there's a compelling argument to be made for using this class of medication. We just have to sort of be able to steer that middle ground where we use it appropriately in the patients who need it and avoid situations where people are getting it from non-reputable sources for purely cosmetic reasons, which is not where the medical debate is.
Always interesting to talk to you, Dr. Christopher Labos. Thanks for taking the time.
My pleasure. You take care.